first of all, thanks for putting this together. I think it's important that we were able to do this, not because I think there's value in it, right? The ability for us to listen to one another and learn from one another's experiences is extremely impressive, and it's an opportunity for everyone. So it's a good one. And thanks for having me do this. More importantly, it's good to see quite a number of people I haven't seen in a while. Andrew, Debo, my buddies back then in the UK when I was still hustling hard. Well, we thank God for where we've moved to now. Conley, Lexor, Tayo, everybody actually. Busola, my people in Abuja, all of you. And those who I haven't seen since we left school, right? Emeka, Moturaya, everyone on the call as well. Shino Adedeji. So thanks for this, and I genuinely look forward to answering some of the questions. But more importantly, if there are specific questions or comments that people have that they think I might be able to answer, I will try my best to answer it in the most appropriate way. Thank you.
Good. Thank you, Banji. So I'm going to go straight into it. Question 1. I want you to take us through the journey of how you got into public service. Was it like always your plan from the time we were in school, or from the time you started to study medicine? So can you just, share a bit how you got into this space?
Okay, thanks. So to be honest, I never saw myself as someone who would work in the public service. If you had asked me in, say, 200 or 300 level, I really just wanted to own my own business and, be at the cutting edge of whatever it was that I was doing. One thing I knew, however, was by the time I was in 300 level, I already knew I wasn't going to do clinical practice. And Kunle probably would understand, you'd understand this a bit better. But if you remember back then in medical school and you see your seniors, I'm like, nah, I'm sorry, guys, this ain't for me, right? But what I didn't know was what I was going to do, right? So in 500 level, when I belonged to a social philanthropic club. I had gone to see one of the very old, one of the senior members of the club at the time, and he used to work at the airport authority or something. So we had a good conversation. The next time I was seeing him, he had left the place, and I said, "Oh, what's the problem?" He said, "No, they brought some young guy from somewhere. He was a consultant, and that they brought him, and there was no way they was going to allow the person lead him." In any case, so he had this really massive school, extremely massive. I hadn't seen anything like that in Lagos. Massive school, primary school with ACs in all the rooms, with swimming pools, and was so full of himself. I was like, look, I'm doing well for myself. I'm not interested in all this again. Like, if I ever need to see him, I should come here. So I then went back 3 months later, and they said he wasn't there. And I asked, where was he? They said he was in an HMO. I'm like, what the hell is an HMO? I said, well, that's where he works now. So I went to see him at the HMO, and I asked him a very important question, like, Egbon, Shekosi, you told me just 3 months ago that you're fine and all is well. All of a sudden you've moved. And I said, Banji, don't worry. I just came here to help my friend. So he gave me sort of an insight as to a completely different aspect of healthcare, right? All the while, all we knew then was you finish your medical school, you do your residency, and then from residency, you just either become a consultant in whatever field. And that was my first almost clearer idea of, okay, there are quite a number of areas, right, outside of clinical practice. So when I finished NYSC, I knew I was going to work in an HMO. I did that for about 2.5 years or 3, and I decided I was going to go do my master's. I had my master's in the UK. I had like 3 admissions, and Debo may remember this bit very clearly. So I had 2 admissions in the University of Birmingham, one for health economics, one for health management. And then I had an admission at the London School of Hygiene and Tropical Medicine, which was the school I wanted to go to. But as funds no day now, I moved all of them by 1 year, right? And unfortunately, London School then said, well, they weren't going to give me the admission again. So I said, okay, let me go to Birmingham. Then I chose health management. And then Debo calls me out of the blue one day and like, Banji, are you okay? I'm like, I'm good. It's like, I saw your name here. They said you've canceled your admission. Why are you changing? I'm like, no, I'm not changing. Anyway, it helped to convince me to move back to health economics, right? So I did that for a year. I was writing my dissertation one day, and I just sat down in the library and I was thinking, look, dude, you're working on this stuff. Yeah, it looks promising, but you just don't know what the future holds, right? So I just literally Googled opportunities in health economics. And then I saw an internship in Norwich. It's a small University of East Anglia. So I applied, got the job, moved to Norwich, and I had this executive director that was such a fantastic guy. The guy took complete interest in me, introduced me to a lot of people, right? British guy, but schooled in Australia. So it was a very different from the typical Brit, right? Then one day we were talking and he said, oh, he has a student who is doing a PhD, he's a Nigerian, that I should meet him. And I was just very like, or all these meeting Nigerian things, I'm not interested. Let me just get my job going, right? So he then introduced me to the guy by name Nisa. Very quiet, unassuming guy. We will talk. He was doing his PhD then. I would help him do some of his analysis, and we'll just choose. He will come, he will go, he will come, I will go. Then one day we were sitting down in his car and we're just talking about Nigeria. And, Nisa, we talked about all the things happening in the health sector, what we could do, how we could help. And then Nisa goes, then I go, oh, well, there are a few people in Nigeria who I think are doing pretty good work, right? And one of them is Dr. Patti. Patti at the time was the Minister of State for Health, right? And that he had worked in MPHCD, someone I really look up to. And Nisa kept quiet and was just looking at me. And Nisa says, Banji, have you been Googling me? I'm like, no, why? He said, Patti is my elder brother. And I paused, I'm like, oh, okay, I didn't know that. Like, so he goes, then he pauses and he's like, do you have plans to move to Nigeria? I mean, chapeau. I'm like, dude, I'm ready to move tomorrow if there's any, if there's any opportunity, right? So he says, okay, when next I'm in Nigeria, I should let him know so that he can introduce me to Patti. I'm like, I'm not one to miss opportunities like that. So I said, well, actually, I was planning to be in Nigeria on Thursday. So if you let me know, I can be in Abuja. It's like, oh yeah, sure. So right there and then, dude linked me up with Patti. So of course, what I then had to do was find a way to take excuse from work so that I could be in Nigeria that Thursday. This was a Sunday. So Monday morning, I sent a message to my boss. I'm like, look, I'm sorry, I have to be in Nigeria. Then I come into Nigeria, fly straight to Abuja, met with Patti for about 30 minutes. Then met with his, he had a senior advisor at the time by name Kelechi Ohiri. And I had almost 2 hours of conversation with Kelechi. And I left the place thinking, wow, these guys really do know what they're talking about, right? Patti is an extremely inspirational dude if you meet him and have conversations with him. But Kelechi was also on a very different level. Kelechi was the sort of person that up to today, is the sort of person that if you have an argument with him, right? If you say black is white, it would convince you that you're incorrect. If you turn the tables around, it has the point to also convince you that you're incorrect, right? It's that good. So eventually they said, look, you know what? Are you ready to move? I'm like, no, I'm not ready to move. Whatever opportunities you have, let me know. But when they put to be honest, when they put the opportunities on the table, I was like, yeah, I think I'm ready to move. So I left JAND in 2013 March, started in April. I worked as a technical assistant with Dr. Patti. And that was where, I began that real public service life, right? Very quickly got introduced to a very good number of senior directors in the ministry. Unfortunately, Patti then left. I think Patti left government about 3 or 4 months immediately after I joined. But Kelechi and the team built a foundation, which was what we really then worked on. And that exposed me, to be honest, Kelechi was the one who really did expose me to a lot of the things that I know now. Engagements at some of the highest level, meetings that you probably would only hear of if you were maybe in the news, or, things like some of the things you probably wouldn't learn in class, right? So it helped, right? And of course, in those meetings, then you're better able to understand how Nigeria works, because you're sitting down, you're listening to ministers talk, and you're like, oh, wow, So we had that. And then in 2015, late 2015, a very good friend of mine who works in the World Bank, I think was the lead health economist in the World Bank in Nigeria at the time, just called me up randomly and was like, look, the minister is looking for a health economist. Are you interested? I'm like, no, I'm not sure. He said, okay, just send me a CV. So I sent my CV, and then one day, someone calls me and says, oh, Professor Adewale wants to see you. So I met up with Professor Adewale, and he's like, look, I I'm trying to put together a team, right, to support me and to build out my plans for the next 3 years. Prof is an extremely optimistic individual, right? He thinks everything can be done, straight away, and he will push for it. So he says, I've looked at a number of CVs, I've spoken to a number of people, but I'm very impressed with your CV. Let's see what we can do. So he keeps talking, and I keep quiet. I'm like, oh man, I'm currently working. It's not like I'm not working, right? So when he finishes, I'm like, thanks a lot, sir, but I would have to, this is a good opportunity. I would just have to discuss it with, my current boss. And he goes, oh, you're working, give me his number, let me call him. I'm like, no, I need to speak to him myself, right? So I had to speak then with my former boss. It took us a while to get things done, but then I moved with Prof. And again, it's been like a trajectory, right? Because then I worked with Prof the first year as a technical assistant. And then the next year, the next 2.5 years, because I was with him for 3.5, was more a senior advisory role. That was where I helped to put together the Gavi support, where we're able to get about $1 billion for Nigeria for vaccines. National program immunization vaccines, where we're also able to work on the basic healthcare provision fund, the one I talked about, and really engage the National Assembly, the presidency, right, to be able to commit the resources to it. Because to put down 1% of Nigeria's annual revenue, federal government's annual revenue for a health program was a big task, right? There were those who were strongly opposed to it on the basis that there was nothing in the health sector, right? Typically, the health sector is considered a cost center. That is, you guys just almost always requesting for funds, but we are not seeing that value, right? So, I mean, working with partners, a lot of our partners in the World Bank, a lot of our partners in USAID, DFID also was pretty solid in helping putting this together. Eventually, in all honesty, some of the biggest names that helped push this was the former Senate President, Dr. Saraki, Bukola Saraki, and the former Chairman, Senate Committee on Health, Tejosho. So because, I think the fact that they were both doctors also helped, and that was a good time for Nigeria, because almost immediately that happened, then DFID committed about $60 million to the program. USAID committed something similar as well to the program. So it was a good time for Nigeria. Then the administration ended. Prof asked that I lead the program, the Basic Healthcare Provision Fund. I did that for about a year. But the way Nigeria is, once the leadership leaves, right, there's always that challenge. So a new guy comes in thinking in his mind that Professor Adewole's stooge, and he had put me there because there was some juice, right, to be extracted. So it was one of the toughest periods of my life, because you had people literally, if they were engaging me from a technical point of view, it would have been easy, but people went ad hominem, right? There was nothing that was not said, from me being Adewole's bastard child. That was why they put me there, to, it was that bad, to all sorts, right? So at a point, I just asked myself that, dude, you're still relatively young. There's nothing here that is out of the ordinary. Just leave, right? At the same time, the governor of Ekiti State was then the chairman of the NGF, right? So we had engaged him a number of times, one as a champion of the Basic Healthcare Provision Fund, but also someone who could also engage his other colleagues. So he was fully aware of all the, the issues around the program. Anyway, so a colleague of mine who is the global director for health finance in the World Bank calls me up on this, like, Banji, look, see, just let me know if you want to leave. I will fix you up. Immediately I heard that, so thank you guys, I'm done with it. So I moved, right? And then I started working with a bank. So I got a contract with the DC Bank this was last year, May. Yeah, last year, May. So I got a contract with DC, doing some really interesting stuff globally. And then in August, His Excellency, Governor Fayemi, calls me up and says, Banji, look, I need a change in my system here. I'm looking for someone to join us. From my state, obviously, and would appreciate if you could come. My sense is he probably wasn't sure if I was going to take it. So the way he was asking was as though, please, we know we may not be able to. right? So, but we had a very good conversation. And I think for me, the biggest thing I wanted from him was to be clear that the authorizing establishment was there, right? Or sorry, authorizing environment was there, i.e., if I needed to see him, I had to be able to see him without going through 3, 4, 5 people. I think that's extremely important if I was going to get anything going. 2 was that we have about 18 months or less. As at the time I joined, we had just about 2 years left. It had to be clear, right, that there was a direction and conviction on part of everybody. So we don't have, because in government, you may have a commissioner for health, then you have like a special advisor on health. I've seen states where you have a senior special assistant on health, then a senior assistant on health, right? So you have all sort of multiple players, trying to get attention of the governor, right? So I said that also had to be clear. And I was like, look, that's fine. All the things you asked for are fine. 31st August last year, I got sworn in as commissioner, and here I am today. So I hope that that sort of gives a sense of how my trajectory has been from wanting really to be one big ass boy making some money, maybe opening one small next flutter wave or something. But here I am serving Nigeria in a different capacity.
Very interesting, Banji. I mean, like, honestly, like all the things you talked, you opened so many interesting topics that I'm going to skip some of the questions in the interest of time. I also want to give people the opportunity to ask questions. So I'm going to say, given what you know of the public service today, what will it take in general? Like what's your prescription for taking public service to the level of quality, high service healthcare that obtains in developed countries? And when we talk about change, given your experience, how will this change happen? Where will it come from? Where's the engine room of the change that we're looking for, given your experience in public service?
So the first thing, right, and this is a personal opinion, the way I look at it is the federation structure that we operate has implications for how our system is designed, right? You have a federal government, you have state governments, you have 36 plus 1 state governments. First of all, everybody is not in the same party, everybody does not have the same ideology, right? So there are different things that people choose to focus on, right? You have a party or you have an administration that must end in 4 years. And so that means that for the average politician, right, if he's not a development person, he's constantly thinking, what is the biggest political capital that I need to get my next 4 years, right? And for that perspective, it's more a conversation around infrastructure. Let me build the roads, right? Because that's visible. That's what people will see and be like, this person did so and so road, right? Let me do the bridges and all that, right? So that's the first thing. The second thing when you come to health is the sort of people that you appoint, right? I think now it has changed a bit at the federal level, but most states, with all due respect to my colleagues, is you bring in a surgeon, a professor, a clinician who's been in the hospital for, say, 40, 34 years, 35 years, pretty much only knows about how to cut, right, or how to administer, see one patient. But health system is much broader than that. And I'm sure a number of people, Debo can speak to this, Conley probably can speak to this as well, and a few other people on call. It's so much broader than that. There's a complete conversation around public health emergency, right? There's a complete conversation around, health system design that as a clinician, it first takes you maybe like a year to first even understand, okay, what exactly am I doing? And that's different from like your administrative work, right? Because in your position as a commissioner, I think there are really 3 things. There's the technical work, there's the administrative work, and then there's the political work, right? And more often than not, people confuse the administrative as the technical, right? So the administrative being you're signing the files, right? 1 or 2 people are going on strike, you need to go and engage them. There is a World Health so and so day, you need to make a speech around that, right? And in your mind, you're thinking, I'm getting work done. But no, that's not the work, because the real work is the technical, is how do you turn around this existing system into a top-rate, high-performing system, right? In Ekiti, for instance, our primary healthcare needs to be better put together. What do we need to do, right? All of those sort of thinking around quality of service delivery, not snapshot quality from an assurance perspective, but a continuous quality improvement that needs to be in place. The same thing with your secondary care facilities. How do you hold facilities accountable for services that are delivered, right? Recognizing that there are unions in place and that people use these unions as well to address, for their own incentives. So there are quite a number of things around that area that are important to take note of. The other really important thing is who you bring in and the critical mass. I'm not saying this because I'm here, but the reality is, if I look at the system here in Ekiti, for instance, there's myself, there's my commissioner for finance. It's not because he's young. There are 3 or 4 other 5 people like that in key ministries that the governor has said, you know what, these guys would help me deliver on specific things, right? And if you look at what we're doing in agri, if you look at what we're doing in education, if you look at what we're doing in health, even what the Ministry of Finance is doing, it's for people that it just truly knows that, look, yes, we need to also help the politicians and get them in government, right? But these are areas of focus that if I leave here in 2022, I want to beat my chest that I did X, Y, Z, and has put those who he believes that can work there. So, I mean, in sum, there is the political structure within the country with respect to the challenge around what the role federal plays versus the role states plays. There's the fact that governors will constantly think about what will give them the big, bang for the buck in terms of the political capital. There is a conversation around who you put in place, right? Because you also have to be able to put someone who understands what he or she wants to do and has the conviction to be able to drive it. It's a long road, particularly for health. Health is not one of those things that you would see substance in 2 months or in 2 years or in 3 years. It takes a while. So there's that on government side, but also on the side of the citizens, things don't move as we think they would move. And I say that with all sense of modesty. Here I am recognizing that I have less than 560 days left in government, right? A civil servant doesn't think that way, right? And sometimes it's not even that the civil servant wants to be slow, but there are processes. If you want to get out procurement, for instance, if you go by the book, it will take you probably 6 to 7 months to get things done because you have to advertise for a certain period of time. You have to shortlist after the advertisements. You have to send out expressions of interest. The RFPs take time. They have to review them. If there are challenges, you go back to step 1, right? And these things take like 6 months. Then even when you agree that, okay, this is the person who will do it, the ESCO has to approve it. Once the ESCO approves it, you have to get what they call certificate of no objection from a Bureau of Public Procurement. Then it goes to the Ministry of Finance. The Commissioner for Finance has to approve it. Then you wait for the warrant for you to get out the money, right? So it's never going to be a directive has been given. This thing will be sorted tomorrow. It takes time. What a lot of smart governments are doing is to find ways to collapse the time between each of these processes so that you can minimize the wastages there.
Got it. So let me try and recap what I got out of the 2 questions. First of all, on your journey, I think it's been one of opportunity meeting preparation. And obviously, I think the lesson I've gotten out of it is that, if you're hardworking and you're good at your stuff, and when the opportunities come, it's the best way to take advantage of the opportunities. You didn't say it explicitly, but I can also sense that you have, or you develop very good relationships with people that make them remember you. Many times you said, someone called you, that's, I mean, it's quite good that, you have developed this kind of rapport and social equity with the people you work with. So I think, when I look at you, I think that's something that I've learned. And the second part on public service, what I took away from your question, from the way you answered the question, is that, it's not as easy as it looks. It's easier said than done, right? Many of us think, you can just say this government is bad, that government is bad. But I was quite impressed with the people you've mentioned so far, Professor Adewale, Governor, His Excellency Fayemi, and the fact that they're super clear on what they want to achieve, in the midst of the political environment that they find themselves in. So I hear it's a long road. I'm not that hopeful, and I'm sure that there are many people who have questions for you. So in the interest of time, I'm gonna, what is sharing something else as well, that you mentioned that, in your work as a as a commissioner, there are three parts of it, and you're playing the three parts. You're aware, first of all, that there are three parts to it. I think many people are not aware. And then obviously you're measuring yourself and making sure you're contributing along the three lines. So that's what I got out of what we've said so far. I want to throw the floor open for some questions. I think many people are dying to ask you questions. So we're just going to do fastest finger first. Any question from the team?
Ayo.
Go ahead.
So I have several questions. First of all, thank you very much for how you've moderated this so effectively, and how, you know, you have made Banji come out and tell us all of this, like, really good stuff. And Banji, thank you so much for like being honest and detailed about this. I got a lot from what you've said. So, and I have several questions, but I'll just like start with a few of them. So first of all, what is the incentive for the governor or the president or anybody in power to address healthcare issues as opposed to building roads or housing estates or some, like, why would the governor want to do this if, you know, there's no direct visible results, as you have mentioned?
So actually, that's a really good question. I'll start with the last point you made. So it's not like there's no direct visible result. The challenge with health, unlike others, is that it takes a bit more time, right? It has a long tail before you begin to see the investments generate any sort of returns. But the reality is, it's two things, right? It's the conviction that you have as an individual in terms of what you want to do and how you want to be remembered. There's always one thing I've seen very clearly with politicians is that there's a legacy issue. I talked about Saraki, and I talked about Teju Show the last time. And one of the things I constantly engage when I used to have conversations with Teju Show is, look, you're ever going to be remembered as Mr. BHTPF if you get us this money out, right? And I think that story sold him, right? And so he kept pushing with his guys, and that was how we got the money out, or at least got the revenue kicked in for BHTPF. I think with respect to my current boss, because he is a development person, he understands very clearly that linkage between health and productivity and economic growth. He gets it, right? So he doesn't need too much convincing to say this is what needs to be done. Last year, our budget for the entire capital budget for health was just about X, whatever it was. But the bigger point is that this year is moved about 300% of what it was last year, right? Partly because he now says, okay, look, we know what we want to do. We have someone that we think understands how we want to move forward. Let's support it with the process. It's not big money. It's not like some Abuja kind of money. We're still a relatively small state, but it's significant enough to drive some changes in the state. The second thing is there has to be a citizens push, right? Particularly for health, as to what you want. And politicians are not stupid. They poll. I remember Rufai saying it once. He said, if you do the polling and you ask what exactly from the citizens do you want, that health never comes in top 3. It's never top 4, right? So why would I, as a politician, also overinvest in health, right? But if people make more of this demand, right, then you begin to see a bit more push or interest from other politicians to also want to invest in health. I hope that answers the question.
Yeah, thanks. And I was rushing to the question just because I don't want to take more time so everybody else can answer. But Banji, I think that you have minimized, and I think I sort of, talked about this a little bit. You've minimized to where you are. And I know that there's humility, and I'm really proud of what you've done, and I'm amazed at what you're saying, which, just to summarize, basically, I'm amazed to know that in our government that we have people who are technocrats that are thinking about these things and trying to address these things effectively. And it's really nice to, to see that, because, you know, you always sort of assume that nothing like that is happening, you know, when you see what is happening, like at the, you know, in the hospital. You know, you go to Luth and you see how like terrible the care is and how things have like decayed in the past like 10 years or 15 years. So it's nice to know that people are like even thinking about that. So I'm gonna shut my mouth now and let other.
So actually, thank you, Kunle. There are a couple of questions. There's Dotun has a question. Lanre has a question. I see Bolaji Gold also raised his hand, and there's already a question on the chat. So I'm gonna let's kind of do some speed dating here. I'm gonna ask that we ask all the questions now. I'll take a few notes so I can recount them to Banji. But can we start with Bolaji, then go to Lanre, then no, I mean let's do ladies first. Let's start with Dotun, then go to Bolaji, then go to Lanre. And there's already a question on the chat, so we take these 4 questions next. Dotun, you have the floor.
Hi everyone. Do I need to turn on my video? Okay, I will just do that. Okay. Hi Banji. Hello everyone.
Hi there.
So I'm really excited because I work with the government too right now. So when you were talking about the procurement process, I just sometimes that's one of the biggest issues that I have as an employee, just the length of time that takes and the fact that you really, in many cases, can shorten that process. So my main question is, how do you right now as a commissioner who isn't really a politician, how do you right now manage the act of getting the job done and having to sometimes pander to the politicians that you have to deal with sometimes? And also, how do you manage with your other colleagues? I would assume that you're probably one of the youngest. And so there are people there who are way older and career politicians. So how do you manage that, considering the culture of age and respect and, you know, just wondering how you get to move around. In some cases, they might want to push back because they just think you're young, and that's the only reason.
Thank you, Dotun. Bolaji.
Okay. Ayo, well done for the job. That's a beautiful presentation and moderation. And Banji, it's so cool to have you there. And that's it. That's a brilliant one. Now, my question is this. I want to know, Ayo mentioned something sorry, yourself, Banji, that it's not always as quick as possible. It's not always as quick as it seems. When you say you want to do something, it takes 6 months, it takes 7 months, and so on and so forth. And you have 500 days. Suppose, do you have a clear picture where, and your governor, does he have a clear picture where you're going to? If not, is there a roadmap in place that actually going to be there for, and is probably backed up by law by your House of Rep, and is going to sustain Ekiti for the next 5-6 years? Suppose you don't win the election the next time and the whole thing is going to be changed. Is there a roadmap that is standard and is backed up by law that will help? Because if you have a place you're going to and someone changes that direction, it's like you're starting all over, and you're going to go through that. And time, as you have really stated, is not going to be enough at all. So is there a roadmap that everybody follows? Is there a standardized place you're taking this state to? Thank you so much. I hope I'm clear enough.
Yes, Bolaji. Lovely question. I love the question. I've noted it down. Larry, your question, please.
Okay. Thank you, everybody. How are you guys doing? Okay, good. Okay, so my main. So as an example, I use the police as an example in Nigeria. In the police as an example. So I assume that so when we watch American movies and we watch Discovery ID and we see the way the police system is operating abroad, You understand? We see how perfect they go about solving cases, criminal cases, murder cases and all. And I used to say that I can even do the police work better than Nigerian police, for example, because we take all these learnings from watching movies and seeing what happens over there. That's kind of example I like to think about in coming to the health system in Nigeria. I used to assume that in as much as we know what is happening over there, can't we just copy and paste the way things are being done over there? Is it something too hard or rocket science? We all know about the healthcare step that they operate there. Is there no way we can copy how these things are done and replicate it here? Is it so hard to do things like that? That was the question.
Thank you, Larry. I got the question. So we have Andrew next. Actually, Andrew, you're going to be the last. And I already have, I don't know the name. I'm sure there's Abdullah there for sure. I have your question on the COVID vaccine. So we'll answer your question first, but I want to take Andrew's question. And I want to say to guys, we have like 20 minutes more.
Yeah, Abdullah.
Sorry, go ahead.
No, it's Binta. I'm just trying to let you know it's Binta.
Binta, yeah, I wasn't sure. I just good to see you. All right, so we're gonna answer Binta's question first, but I want to take Andrew's question, and I want to crave indulgence, guys. With 5 questions, we probably will need to extend a few more minutes. If you're cool, please, let's stay on. I think we're gonna have a good time. So Andrew, you have the floor.
Yeah, thanks, and I want to echo what everybody else has said in terms of how you've moderated. And Banji, great to see where you've come, how far you've come, and the humility that you demonstrate is really, really good. My question is really around infrastructure, right? So you studied health economics, and I see quite a few people in our generation moving away from being your typical physicians and moving more into the health economics sector. So the first question is that a theme that you see, and is that because of the frustrations? And then the second thing is, to what extent is your campaign going to look at private-public partnership on some of the infrastructures that you have to set up and some of the services that you need to deliver? Is it purely a public play, or is it going to be private as well? That's it.
Thank you, Andrew. So Banji, we're gonna do speed dating. Like, give us your fastest questions, just because you have 6 questions. I think your answers will also spark conversations. So I'm going to start with Binta's question. What's the modality for disbursing the COVID vaccine? There's some info online that, Ekiti State has been able to give a woman who's 101 years old in some rural location the vaccine. Like, how are you guys? What's the modality? Like, who is being prioritized? Have you rationed it? Somebody wants to know.
Okay. So the directive from federal government is to prioritize healthcare workers, prioritize frontline workers, and strategic leaders, right? In our instance, we're doing the same. So across all the 16 local governments, we have vaccination teams in fixed sites, as i.e. the facilities, but also we go around. Specifically for the lady, the 101-year-old woman, we thought it was important to also do that for her, because they are ideally what federal will call phase 2, that is the elderly, but she's such a big name in the environment, right? We consider her a strategic leader, and so it was important that we vaccinated her, and she could also serve us as a campaign. And I mean, it's evidence, the testament to what we've done, that you noticed that, right? It's also enabled people to be interested in going out to get the vaccine. We only really started vaccinating people in Ekiti this week, and as at this evening, we've done over 12,000 people. So there's quite a significant interest from a lot of people to get the vaccine in the States.
Fantastic. We go to Andrew's question. It has 2 parts. So first part, public-private partnership in terms of putting in infrastructure. What's your take on it? And the second part is, is health economics a new trend, or is it about how does it connect to clinicians and doctors?
Yeah. So PPP is, for several reasons, it's the right thing to do, particularly in health. I mean, globally, you may have the conversations around it, depending on how it's structured, may be tricky, right? But for health, it's an important thing to do. One, in Nigeria, because the resources are not even there to do everything, right? So you have to be careful around what you can push for. In our state, for instance, it's important that we have an oxygen plant. So in Exut, which is a teaching hospital, the teaching hospital keeps saying, oh, we can build it. I'm like, guys, just drop that, right? You don't have what it takes. It will cost you almost 150 million to get a 20 cylinder a day, about 105 million to get a 20 cylinder a day machine, not stock of plant, not talk of a 40 or a 60, right? So we're engaging PPPs to bring this in, and that's one opportunity. Laboratories is also another big opportunity, diagnostics, broadly speaking, right? And we're seeing quite a good chunk of that, not just in Ekiti, but across the states, across the country. In Lagos, for instance, LUT has a host of, diagnostic PPPs that they've done. There's NSIA with LUT, there's a Bridge with LUT, and a few others. So PPP is the way to go. On the issue around infrastructure, around clinic versus, MPH, I think my sense is that there has to be a conviction for the individual. Unfortunately, a lot of people who move, at least in Nigeria, that move from, it's not, so let me put it this way. I don't think that the bigger chunk of people who would want to move away from clinical practice, I think is more the conditions of law alternatives, right? And so I remember very clearly there were a good number of my colleagues, those who were in Unilag back then, who started writing their PLAB. I didn't write PLAB, and people thought I was foolish. I remember I was like, I'm not doing clinical medicine. If I write PLAB, I'll be tempted, right? But they did PLAB, and then of course, they moved back. So they had done their masters, but then they moved back into clinical practice. So I think that you continue to have a lot of people who will do it as an opportunity to get into a system outside of the country. But as the system grows better, as the environment becomes more conducive, that's probably in Nigeria, a lot more people would also stay in the clinical practice.
Got it.
Thank you.
Now, I'm going to ask you, I'm going to combine, I think there are 3 questions around the same thing. So yeah. Dotun talked about it, Bolaji talked about it, and I see Wale also put a note up. So it relates to what you talked about, when you mentioned technical work, administrative work, and politics. And I think from Wale's point of view, he said, if you were to allocate your time, how do you balance the allocation? What is priority? And, when do you, for example, figure out that, oh, I should be spending more time on the kind of thing that Bolaji was talking about. So I'm going to link it to Bolaji's question, because Bolaji is saying basically, where is there, knowing that you have a finite period of time, is there a roadmap? Is there a blueprint? What should we expect? Is there a legacy that you want to leave behind that other successive governments can pick up, and it transcends political affiliation? Like, the document is so damn good, right? Like, everyone wants to use it.
Yeah.
And
so
answer that, then
I think, okay.
Go ahead.
So it's an interesting question, and the reality is, look, I worked on Basic Healthcare Provision Fund. We put as many things in terms of checks and balances to ensure that the program would live beyond Professor Adewale's term. Immediately Prof left, right, things fell apart, right? So that's one. Now we're trying to renovate all of our secondary care facilities, and want to put equipment in them as well. Of course, this equipment costs some money, right? So it's not like we have all the resources on day one. If you speak to the biggest suppliers in Nigeria, the idea is to do what you call a lease, operate, maintain, and transfer. But everybody's worried about, if you live in 2022, what happens? Then our exposure post-2022, what happens? So our plan is simple. We'll give you an irrevocable standing purchase order, right? Which says essentially that you can take from source money if we default on this. But then you still engage with the manufacturers, the Philips of this world, the Gs of this world, the Siemens of this world. And everybody's like, look, Banji, we know how Nigeria works, man. We're sorry, but anything that goes beyond this, right? The reason why I'm saying this is you can have the tightest legislative backing, right, in terms of an enabling environment, whether from a policy perspective, whether in terms of legal. Oftentimes, you still come into that fix. Lagos was in that fix with the PPP on the Lekki concession, right? You still come into that fix where a new government plays a funny role, right? We hope, to be honest, that whoever succeeds Dr. Kayode Fayemi's administration in 2022 is someone who will continue with the work that has been done. But specifically for me, I think the big ticket items are pretty simple. There has to be within the states an accreditation and standardization agency, right, that monitors the quality of care that is delivered. And we set up that committee, and we're taking that to the House of Assembly. We'll get it passed. The governor is going to assent to it, and we'll develop what it takes for that to move forward. Closely related to that is the continuous quality improvement that must be embedded within each facility. And then there must be clinical audits, right, for every death that we have in the states. Not because you want to attack any of the healthcare workers, but more from how do we learn, right, from what we've done to improve what needs to be done. So the point I'm trying to make essentially is, look, you would set it up, and that's what we will do, particularly the legislative environment, the framework, and also the policy. But there's only so much sustainability that you can promise or you can guarantee once a new person comes in. People get, we're saying, especially when there's a change in parties, even when there are changes within the same party, things can get tricky. So it's always important that we hope that you have the succession plan, right? Whoever succeeds, that governor is able to do well. But I think for me as an individual, the more important thing is that for two reasons. One, relatively, I am young, right, compared to other members of cabinet, right? And it's important that I'm able to move the needle so far apart that it is so hard to pull back for the next person. It becomes so difficult for the next person to pull back and say, no, we're not doing this or that any longer. And that's why I constantly count my days, knowing that I'm not here forever, and I have to do everything at a speed, at lightning speed. Thanks.
Banji, build on that for Wali's question, which is, how do you balance the time? How do you allocate that?
So I delegate a lot. I have a decent permanent secretary. I have a fairly good team. I've looked at those who I know are really good, and I've just put them in positions, right? I used to have a state epidemiologist who was slow. I've moved him out. I've taken someone else now, right? I'm not here to be nice to everybody, right? I want them to respect me for my work and get going on it, right? So once you understand, once people know that you would judge them based on their competency, then they step up. There'll be those who will grumble, but they will really step up. So there's that. The second is I am very focused on the things that will be sustainable, and that, like my boss calls it finishing well, that people would see and be like, okay, it was during Fayemi's time that they did this, right? So I can't do all 10. I'm focusing on 3 or 4. We would address issues around our primary care, we'll address issues around our secondary care, we would establish some relevant agencies to get things going, and just hope that the next set of people who come after us will be able to take these things forward. And even if they don't, right, you'd have created a critical mass of people within the civil service, that buy into that vision and will be able to push it beyond you.
Fantastic. So we're doing good, not too badly. I see a lot of questions and comments flooding you, but please stay with me on this one. Doctor's question: how do you manage not being a politician? How do you manage with other colleagues? How do you manage the youth? I think you should really expatiate on this, because I'm going to tie it to one of the questions we discussed in our preparation. That what are your challenges and what would be your advice